Right now, 12 million Americans are injecting a peptide into their bodies once a week. Most of them have never been told what it actually does. It teaches your stomach to stop working. Some of it does not relearn. This is what that looks like. From the inside, stage by stage. The first 6 stages are invisible. Stage 7 is where the stomach forgets entirely. Stage 1, delayed emptying. The peptide is called a GLP-1 agonist. Semaglutide, tirzepatide, brand names you already know. Its primary job is to slow down your stomach, deliberately, by 30 to 50%. That is the entire mechanism behind the appetite suppression. Food now sits in your stomach for hours longer than it was designed to. You will not feel anything yet. The clock has simply started. Stage 2, early satiety. Within a few weeks, your stomach can no longer hold a normal meal. 4 bites in, you feel full. 8 bites in, you feel nauseous. This is the marketed effect. What is also happening, quietly, the stretch receptors in your stomach wall are firing at the wrong volumes. The signal to your brain is being miscalibrated by the drug. Your stomach is no longer accurately reporting itself. Stage 3, functional dyspepsia. The bloating starts, the reflux, the pressure under the ribs that does not go away. You burp and taste meals you ate yesterday. Your gastric pacemaker, a cluster of cells called the interstitial cells of Cajal, are the conductors of stomach motion. The drug has quieted them. The orchestra has fewer instruments now. The music still plays. It just plays slower and less in rhythm. Stage 4, subclinical gastroparesis. You schedule a scan, a gastric emptying scintigraphy. It is the only test that catches what is happening at this stage. You eat a radioactive egg. They measure how much is still in your stomach 4 hours later. Above 10% retained, your stomach is officially failing to empty. Most people on these drugs are never offered this scan. They simply normalize the symptoms. Stage 5, Bezoar formation. When food does not leave the stomach, it does not just sit there, it compacts. Undigested fibers, hair, vegetable matter, and pill capsules begin to bind together into a solid mass. This is called a phytobezoar. The mass grows over weeks. It can reach the size of a fist. It cannot pass into the small intestine. It cannot be vomited out. 2. Removing it requires endoscopy, sometimes surgery. Stage 6, aspiration risk. You schedule a routine procedure, a colonoscopy, a wisdom tooth extraction, anesthesia. Your stomach is supposed to be empty after 12 hours of fasting. It is not. 3 days of food is still sitting there. When you go under, the muscles that protect your airway relax. Stomach contents rise and enter your lungs. This is called aspiration pneumonitis. It can kill. Stage 7, permanent dysmotility. You stop the drug. The peptide leaves your bloodstream within a week. The receptors clear. The stomach does not. In a subset of patients, the gastric pacemaker cells never return to baseline. The vagal nerve signaling stays dampened. The motility patterns are gone. There is no medication to restore them. You eat, the food sits, the bloating returns, the vomiting returns. Months after the drug is gone. From the outside, a person in stage 7 looks like they are simply not hungry anymore. Inside, their stomach has forgotten how to be a stomach. There is no warning at stage 1. There is no scan offered at stage 3. There is no coming back from stage 7. If you are on one of these drugs, do 2 things. Ask for a gastric emptying scintigraphy if you have symptoms beyond mild nausea. And tell every anesthesiologist before any procedure, stop the drug at least 1 week before, sometimes 2. This single conversation can save your life. Send this to anyone you love who is on one of these injections. The next video goes inside a different organ. The story is just as quiet and just as irreversible.